I do think with dados, for example, I think Brazil is certainly, in terms of large countries, probably ahead of any other that I can think of in the collection of data and in the digitalization of healthcare and healthcare delivery. But I think this discussion about how to make healthcare systems sustainable in the service of the people that they're supposed to serve, it's been a sterile discussion. It hasn't even really been a debate. It's just been people talking at each other. And I think we need to stop that. More than think, I'm pretty sure we need to stop that. And what I would love instead is a real conversation.
Oi pessoal, tudo bem? Começa agora mais uma edição especial do Futuro Talks. Hoje vamos falar aqui sobre o cenário mundial da indústria farmacêutica. Sabemos que o Brasil é um país importante e estratégico dentro do cenário mundial, mas na conversa de hoje vamos entender o papel do país, as tendências do mercado farmacêutico e as apostas para o futuro. Antes de eu apresentar o meu convidado, eu não posso esquecer de falar para vocês assinarem o canal e ativarem todas as notificações. Essa edição especial do Talks é oferecida pela farmacêutica Roche. Bom, agora eu vou apresentar o meu convidado de hoje. Ele tem mais de 2 décadas de experiência na indústria farmacêutica em diversos mercados ao redor do mundo. Desde 2004, ele ocupou várias posições-chave na Roche, incluindo vice-presidente da unidade de câncer de mama, gerente-geral da Roche Farma França e chefe da região da Roche Europa. Desde junho de 2018, ele é o CEO da Roche Farma Internacional, que engloba os 8 principais países para a empresa, incluindo a China e o Brasil. Eu queria dar, então, as boas-vindas ao Padraic Ward. Seja muito bem-vindo, Padraic.
Thank you very much. Thanks for the invitation.
Muito bom ter você aqui. Aliás, eu já aproveito, vocês já devem ter percebido, para trazer mais um aviso. Esse programa ele vai ser conduzido em português e em inglês. O Padraic entende e fala português, mas a gente acha que a fluidez vai ser melhor se cada um falar no seu idioma favorito. Vocês vão poder contar com as legendas. Padraic, vamos lá, vamos começar, vamos. Muito bom ter você aqui, muito obrigada. Queria começar fazendo uma pergunta talvez um pouco mais abrangente para a gente situar a nossa audiência. Você tem uma extensa experiência na indústria farmacêutica, conforme eu li o seu currículo, e acompanhou de perto, imagino, as grandes revoluções da ciência e da saúde, que incluem mudanças de portfólio, estratégias, novas tecnologias e até a forma como os negócios são feitos. Com essa visão ampla sobre o mercado internacional, qual foi para você a principal mudança, ou talvez a principal revolução da indústria farmacêutica, e aí talvez nos últimos 5 anos?
Yeah, in the last 5 years, I'm not going to give you a surprising answer, I don't think, Natalia, because just like we're all going through a data revolution in pretty much every aspect of our lives, the same is true for healthcare. It might actually be more true for healthcare than it is for any other sector. But, I see now more and more the use of data analytics, the use of artificial intelligence in every aspect of healthcare, including in what we do. And more we're investing in the capacity to use huge amounts of data to understand better disease biology in order to figure out then how better to interfere in that disease biology and cure people. We can understand diseases in a way that we never could before, and I still think it's only the beginning. And I'd expect that to turn into better and better medicines, better and better diagnostics, better and better ways of preventing disease. And so that's the revolution. It started, but it's a long way from being over.
É empolgante, né, Padraic?
It really is. I mean, you can probably tell from my voice how excited I am about all of this.
A gente acho que vai conversar um pouco mais adiante sobre a questão do uso de dados, da inteligência artificial, como você mencionou, e como isso já tem causado essa revolução na saúde. Mas acho que antes eu queria dar um outro passo aqui, pensando nas transformações que eu sei que a própria Roche tem passado ao longo de todos esses tempos, né? Ela teve uma grande transformação interna na forma como trabalha e também como se relaciona com os stakeholders da saúde. Ou seja, foi além da mudança da cultura organizacional, né? Que eu acho que isso também já é um grande desafio. A pergunta eu sei que você liderou essa transformação na Roche, e eu li um artigo que você escreveu no LinkedIn, em que por 2 anos você teve que repensar, reaprender e aplicar essa nova mentalidade também de liderança. Como que foi fazer essa transformação num mundo já em transformação? E qual que é o status atual?
Well, it's another one of those things that has been started but not yet finished. When I took on this job, Natalia, I was thinking about the fact that in every aspect of our business, we were doing things differently, more creatively, with more innovation, using more technology, except in the way that we interact between us and the healthcare systems. And I began to wonder why that was true. Why is it that we have new kinds of medicines, new kinds of diagnostics, new kinds of ways of organizing healthcare systems? But then we as an industry, when we work with healthcare professionals, we do things in exactly the same way that we always did. And I thought, as I looked at the need that I was hearing from our customers from the healthcare systems, what they were telling us was, yes, we still need you to tell us about our medicines and how to use them, but we also would value you participating and helping us figure out how do we use them in the context of the healthcare system? How do we actually insert them into the healthcare system? But that required us to organize ourselves and the work that we do in a totally different way. I'd been through, and I'm sure anybody who's worked in any industry would tell you the same thing, I'd been through many changes, organizational changes, where you spend a lot of time and effort and you end up with the same people doing pretty much the same work, just in a different organizational model. And it doesn't give you a different result. And when I started thinking about why that might be, it occurred to me that actually the problem was probably people like me to begin with. And that if we kept leading in the same way, then we would be asking people the same kinds of questions that we'd been asking them before, and there would be no chance that they could do their jobs in a different way. And so we did that. We started with me. So when I took on this job that I have, the first thing I had to do, which was a little bit painful and difficult, was to put aside all of the things that had helped me to get to this job in the first place and to relearn or to learn a new way of leading. That and all the people around me and all of the consecutive leadership groups in the company. And so we did that for 2 years and then ended up being able to say, okay, now we can figure out a different way of interacting with our customers and a different way of providing value. So it's been like 6 years now we've been doing this. Customers tell us they're getting a different experience. It's not perfect, and it never will be perfect, but it's in evolution. And I think we're doing better than we were before.
E Padraic, você, dentro da tua experiência, né, e depois de toda essa transformação, e eu fui acompanhando o seu currículo, você já assumiu a chefia de várias áreas dentro da Roche e hoje lidera essa área que contempla os 8 principais países, incluindo o Brasil e a China. E não tem como eu não perguntar e não refletir um pouco sobre isso, né? Imagino que cada país tem a sua particularidade, não só da população, não só em relação às questões de acesso, né, se é sistema público, se é sistema privado, mas também legislação. Como que é isso? E quais são as particularidades, né? Qual que é a dificuldade de atuar em diversas regiões e como fazer isso na prática, né?
Yeah, I mean, it's even more complicated than that, actually, because it's 150 countries that are in the area I lead, and 8 of them, the biggest 8, including Brazil, then report directly to me. I've drawn a bit on my own experience, Natalia, for this. I've lived in 8 or 9 countries, don't even remember.
8 or 9?
8 or 9 different countries. And there are differences, and I love those differences, difference in language, difference in culture, difference in food, all of those things. But actually, the thing that strikes me is that people are way more similar than we are different from each other. And the same is true of healthcare systems. In other words, there are differences in maybe the last little bit of how the healthcare gets delivered to the individual patient or patient group. But healthcare systems at a certain level are organized in pretty much the same way. You know, there are doctors and nurses and hospitals and administrators and pharmacists and all of those things. And so we've kind of focused more on that as an organizing principle, just to be able to say, actually, there's a certain similarity between things, between healthcare systems. So let's use that similarity to say, let's learn from each other and figure out how we can do things in the same way until that last bit, and then give the people in the countries the ability to say, okay, for the specifics of our country or the specifics of the healthcare system we're dealing in, we're going to do things slightly different from others. So I think it's organizing around a set of principles that say, in general, Where there are similarities, we're going to do things in the same way. And where there are differences, then we give ourselves the opportunity to do that. The key bit that we focus on is to say we work towards what we call a triple win. In other words, whatever it is that we do, it needs to benefit a patient. If it doesn't benefit a patient, there's no point in us doing it at all. It has to benefit a healthcare system or the healthcare professional that works in it, and there has to be a benefit for Roche as well. As long as we keep that in mind, then it's possible to do things in 150 similar and different countries.
Perfeito. E eu estava aqui refletindo sobre essa sua resposta, né? E de seguir esses 3 pilares, como você mencionou, Padraic, e refletindo um pouco também sobre o Brasil, né? Eu acho que eu tenho muita curiosidade de entender como que você vê o Brasil dentro desse contexto. Eu entendo que você diz que nós temos mais semelhanças do que diferenças e que, obviamente, você atua nas diferenças quando elas precisam ser endereçadas. Mas o Brasil, a gente tem aqui uma particularidade, acredito que especial, não só porque sou brasileira, mas a gente tem essa questão do nosso sistema de saúde, que ele tem um SUS, né, que abarca mais de 80% da população, 25% depende, né, usa os planos de saúde, na saúde suplementar. E a gente tem dimensões continentais, a gente tem muita desigualdade de acesso, a gente tem um desejo, né, de ter acesso às principais inovações para que elas cheguem de verdade para as pessoas. Mas eu queria um pouco da tua análise específica do Brasil. Quando você compara todas as experiências, os países que você já morou, os países que você lidera, qual que é o potencial? Primeiro, como que é o cenário atual do Brasil? E segundo, qual que é o potencial do Brasil diante do mercado mundial?
Wow, there's a lot of questions in that one question. Look, first of all, I have to declare a bias. You know, I lived in Brazil, and I have family connections with Brazil, and I have Brazil has a special place in my own heart. And so I'm a bit biased in the way that I think about Brazil. That being said, even without the bias, Brazil is really important for us now. As I said before, of the 150 countries I lead don't all report directly to me. 8 of them do. And just like China or the big European countries, the team here in Brazil reports directly to me and to our global headquarters. I think, it's in what you say it's something we recognize and we're happy to deal with. I mean, every time I come here, including this last couple of weeks and I've been here, people tell me that there are lots of Brazils within Brazil. And I would say, that's cool. So let's work with lots of different Brazils within Brazil. And we're totally happy to work with the private sector. We're totally happy to work with the public sector. We're totally happy to work at a federal level or a state level or a municipal level whenever that's necessary and important. I think Brazil has huge potential, actually. And I see how seriously consecutive Brazilian governments have taken healthcare. I saw, and I've been sending around the article that Bill Gates wrote about the SUS to everybody I know, because I do think it's a wonderful story. And just like every other healthcare system in the world, it isn't perfect and there's loads of challenges. But on the other hand, there are many things good about it. And so what we're trying to do now is to say, okay, how do we recognize the different realities even that exist within Brazil, and how do we act as a good partner for them? It's not always going to be possible, but we're open to talking to anybody who will talk to us about how we can contribute and what it is that we might be able to bring.
E você tem visto, Padraic, o Brasil crescendo do ponto de vista internacional, assim, a potência do Brasil, ele passou a ser, você disse que o Brasil tem um grande potencial, mas ele passou a ser mais reconhecido como um país potencial dentro até de estratégia de negócio?
I think there's 2 ways of looking at this. If you look at the business and the growth of our business, and for sure it's growing. There is always some frustration, I have to be honest, in the sense that for us and probably others in the industry, what's important is some stability over time. So if we make an investment in something, the cycles in our industry are really long. And so if the rules of the game change very often, it's really hard for us to invest. And we have had that as a problem. So that's one obstacle. Another area which is maybe less obvious to people, even here in Brazil, but which is, I think, really important, is how many Brazilian doctors and hospitals and universities participate in the global trials and development of medicines for us. And over the past couple of weeks, I've met really world-class investigators who participate, and it's not just a passive participation either. They're directly influencing the way that medicines are developed, not just for Brazil but for the world. And that I see happening more and more. I see it happening in cancer care. I see it happening in hemophilia. I see it happening in Duchenne's muscular dystrophy and more. And I think that maybe that's not so visible to people, how important that Brazilian that scientific involvement in medicine research and development is growing stronger and stronger.
Isso deve aumentar ainda mais, né, porque você obviamente deve estar ciente disso, né, que a gente está nesse processo de ter novas regras para a pesquisa clínica aqui no Brasil. Então, existe uma grande expectativa de que os brasileiros, os centros brasileiros, possam participar ainda mais desse processo, né?
Yeah, I do. And I do think it's at least on paper, it looks like a really important advance. And then, like any rule anywhere, how it gets implemented is going to be key. It's having the rule or the law there in the first place is helpful, but making sure it gets implemented really well would be superb.
Agora, uma pergunta também ainda no nosso cenário brasileiro aqui, porque a gente tem, desde esse novo governo que assumiu, um novo direcionamento em relação ao nosso desenvolvimento do Complexo Econômico-Industrial da Saúde. A grande expectativa é que aqui no Brasil seja possível produzir internamente 70% das necessidades da nossa saúde, né? Isso vai desde equipamentos até medicamentos, insumos e tudo mais. Queria um pouco da tua visão, como que você vê essa ambição do nosso governo. Como que isso, de alguma forma, está ou não conectada com a estratégia da Roche?
We're totally behind the idea that Brazil should have an industrial or a life sciences sector policy and should become stronger for some of the reasons I mentioned just a minute ago. I think, if it can help deliver better healthcare to Brazilian people, for sure, that's a great idea. If it can help really smart Brazilian people participate more and more in global trials or scientific innovation, I think that's absolutely brilliant too. Bringing more production facilities to Brazil could be a good thing. I don't know enough about it to be able to really say whether that is workable or not. The one thing I would say is I don't know of any country in the world, including China or the United States, who's able to be 70 or 80% completely self-sufficient in the manufacture of anything. And it's because just by its very nature, the complex nature of manufacturing a product in any medicine means it requires different things from different parts of the world. You don't really find everything that you need in one single place. So I hope as that goes forward, it will mean that Brazil will be more interconnected to the manufacturing and production of medicines worldwide, but as part of a global supply chain or a global process rather than a standalone or autarkic one.
É importante você trazer esse ponto, porque era uma das perguntas que eu ia te fazer. A partir do seu conhecimento, se você tinha algum país de referência, de benchmark, eles produzem 70%. Então, não.
I'm not aware of any, no.
Tá, perfeito. Agora, um outro tema que a gente aborda muito aqui no Futuro Talks é a questão do acesso, né? Eu sempre cobri saúde, né? A gente conversou um pouco antes de começar. Sempre fiquei muito próxima do que tem acontecido em termos de inovação, do que pode chegar para as pessoas, do que faz diferença mesmo para a vida delas. Mas não necessariamente essa via tem um final que chega de verdade para o paciente que precisa. Você sabe bem disso. E aqui eu sempre tento trazer essa provocação a todo mundo que senta nesse sofá rosa para tentar trazer soluções e discussões sobre novos modelos de acesso, outras formas de pensar para que os novos medicamentos, as terapias, as estratégias cheguem para as pessoas. Então, eu sei que a Roche, aqui no Brasil, inclusive, tem algumas iniciativas nesse sentido, mas queria que você trouxesse um pouco, talvez, de cases e de experiências internacionais, de possibilidades para melhorar esse acesso.
I agree with you, and I think for far too long, not just in Brazil, but nearly everywhere in the world, I think this discussion about how to make healthcare systems sustainable in the service of the people that they're supposed to serve, it's been a sterile discussion. It hasn't even really been a debate. It's just been people talking at each other. And I think we need to stop that. More than think, I'm pretty sure we need to stop that. And what I would love instead is a real conversation that starts with an agreement on what outcome is it that we're trying to actually achieve. Can we agree on what it is that we're trying to achieve together and then make progress towards that? There are plenty of examples around the place. In Côte d'Ivoire, in West Africa, for example, that's exactly the discussion that we had with the healthcare authorities there. And we were able to come up with something then that it doesn't solve every single problem, but it does make more of our medicines available to patients in that country in a way that fits with whatever the needs are there. It's one example. There are many around the place. I think the biggest ones that I've seen actually were all during COVID. And I think the emergency nature of COVID forced all of us to be able to sit together and actually quickly talk about what is it that we need to get done? What is it that needs to happen? And then mobilize the pharma industry or the life sciences industry, governments, regulators, and others to be able to say, okay, how can we get this done together? And it was a really painful period for the whole world, this was. But I think there was a silver lining to it, and that was we did actually accidentally, or we were forced to learn how we would all work together, focused on an outcome. And, when I look at the development of medicines, the development of diagnostic tests, the development of vaccines, and much, much more, things happen at a speed without losing quality and without losing the appropriate governance. We were able to do it faster. And I would wish that without the need for a pandemic, we were able to get back to that again and talk about outcomes.
Eu fiquei curiosa com a tua resposta, principalmente em relação ao Covid, Padraic. Você acredita que esse foco, né, e essa abertura para o diálogo de vamos todos olhar para qual que é a necessidade da sociedade, da população e direcionaremos ali, ficou como legado? Ou passou a pandemia e as pessoas ainda não estão mais tão abertas para o diálogo?
I don't think we've gone back to how it was before, but it's still not the same as it was during. I think we did lose a bit of that, and it's natural. There was an emergency. When you have an emergency, it does focus everybody's minds a lot. I think there is more space for dialogue now still than there was before the pandemic, but I really hope we don't lose it. And in order not to lose it, we're going to have to want to not to lose it. In other words, we're going to have to pay attention to this and be intentional about it rather than hoping that it's going to continue.
Perfeito. E agora uma pergunta ainda do cenário brasileiro, né? Você estava trazendo alguns exemplos desses acordos, né, em diferentes países. E eu sei que aqui no Brasil a gente tem alguns modelos ainda sendo feitos em contextos específicos. Tem cases que você leva do Brasil e aplica na China, e aplica num país africano? Tem coisas que tem essa troca? É uma curiosidade minha, assim.
Absolutely there is. And we do it all the time within Roche. And so I was going to say encourage. It's actually a bit more than encouragement. I'm pretty insistent with the people in the different countries that they should be talking to each other all the time, not duplicating things and really learning from each other and then taking whatever it is one step forward. So we do this pretty deliberately. Again, in the meetings I had in the healthcare system with people from the healthcare system here in Brazil, I see people in the healthcare system doing that as well. I mean, spontaneously people have said, oh yeah, we were last week or last month we were in Angola and we were helping the government of Angola to figure out how they could do things that had been done here in Brazil. And I see people going from Brazil to other places to learn how there could be things there that would be useful. So I see it happening a lot. Sometimes it's kind of quiet. People don't speak about it a lot and you don't hear about it, but it really does happen.
Interessante. Agora vamos falar sobre um tema que você puxou logo no começo da nossa conversa, que é essa nossa tendência de digitalização, né?
Yeah.
A utilização dos dados da saúde pode ajudar a guiar a jornada do paciente e é um dos grandes desafios de quem atua no setor, inclusive. É uma pauta bem recorrente aqui. A gente fala de interoperabilidade, a gente fala do que precisa fazer para que ela aconteça, enfim. A gente tem um olhar do governo federal para isso, inclusive para a busca da saúde digital, inclusive com uma Secretaria de Saúde Digital que foi criada no governo atual, e um olhar, precisamos fazer isso acontecer. Queria a tua visão sobre isso agora, né? Eu entendo, e você disse no início que essa é uma das grandes revoluções, né? Os dados balizando a tomada de decisão. Mas como você vê isso acontecendo? Principalmente essa questão da interoperabilidade e essa jornada, inclusive, do paciente conectada aos dados e à tecnologia.
Yeah. That's a great question. Somebody told me during the couple of weeks that I've been here, somebody said, Brazil is a country that is rich in data and poor in insight. In other words, there's plenty of data in the system, but it's really hard to put it all together. Really hard to put it together to use it for anything. I do think with data source, for example, I think Brazil is certainly in terms of large countries probably ahead of any other that I can think of in the collection of data and in the digitalization of healthcare and healthcare delivery. For sure, there's a problem of interoperability. It's hard to make the systems. They don't really talk to each other. Perhaps artificial intelligence can help us with that. I'm not sure that it's the complete solution, but it could help. But I think the more and more we can design systems so that they can talk to each other, so that the data can be used, so that a patient's data can follow them from one part of the healthcare system to the other, the better. You probably know the European Union has a significant piece of legislation underway to create a common European health data space. One of the things that they have recognized is to say, actually, if we don't build in principles around interoperability, in other words, if we don't use the same codes and the same names for things everywhere, the chances of the system working are pretty small. So I think it's going to take a bit of that. It's going to take a bit of effort to make the systems be interoperable.
Em termos de maturidade, não só brasileira, mas mundial, e você agora citou o exemplo da União Europeia, ainda tem um longo caminho para a gente ver isso acontecendo de fato, né?
Yeah. I would say yes, and these things sometimes take me by complete surprise about how fast they move. I mean, if I look back at some of the things that are happening around artificial intelligence or digitalization of healthcare systems, and if you asked me 2 or 3 years ago, would I have predicted that we are where we are now? If I were being honest, I would have said, actually, probably not. And so sometimes things move faster than we expect.
Agora, sobre a inteligência artificial, você olha para isso de forma estratégica? Eu entendo que veio um boom, né? Acho que ninguém esperava em nenhum setor desse potencial do que poderia acontecer com a inteligência artificial e do que a gente tem visto. Ao mesmo tempo, tem uma grande discussão sobre as formas de utilizá-la de forma segura, de que traga ganhos para os negócios, para as empresas e para a sociedade. Mas queria entender, dentro da tua gestão, do teu olhar, como que você olha para a inteligência artificial e como que ela está presente dentro da Roche.
Very present. Pretty much everywhere. I see it in a research organization. I see it in the development organization. I see it in the manufacturing organization. To some extent, although a bit less in the commercial organization. And the trend is definitely moving forward. The thing about it, as we all know, as human beings, we're really bad at predicting the future. And so I don't think it's possible to tell with any great certainty, in 5 years' time, where will we be with this? We could probably guess, and we'd nearly all be wrong. I think we have an opportunity here to learn as we go. And I see that's what people are doing. They're looking for use cases, ways that they can apply some of these things and then testing it and moving forward with it. I think that's going to keep happening. But for sure, it's going to be in ways that I don't know and couldn't predict, it's going to be a way bigger part of our research and development efforts, say, than it is even now.
Dos pontos que se diz em relação às tendências da inteligência artificial é, inclusive, conseguir descobrir e desenvolver medicamentos de forma mais rápida, né?
Yeah. Exactly.
E isso já está sendo aplicado?
Oh, for sure. And it's not just the development of medicines, it starts way before that. It's the use of huge amounts of data and data analytics to understand the biology of disease even better. Because that really is the key. If you can understand what causes a disease or what causes a disease to get worse, once you've done that, then it's not simple. Don't get me wrong, it's not simple to do to discover and develop a medicine after that, but it definitely is easier because you know what it is that you're supposed to be focusing on. So I see huge applications already there.
E agora uma outra pergunta sobre descentralização. É uma das tendências que eu queria te ouvir em relação à saúde, também focada no Brasil. No Brasil, por ter esse país, né, de dimensões continentais, como você bem disse, né, tem muitos Brasis dentro do próprio Brasil. A gente tem, obviamente, esse olhar nacional, mas também é importante ter esse olhar local, né, para as necessidades daquela população. A gente tem algumas tendências de regionalização da saúde aqui no Brasil. Quais são os caminhos que você vê para o nosso país pensando nesse cenário da descentralização da saúde?
This is one of those things that is common across countries. I think every country's healthcare system is under some degree of pressure, and it shouldn't really be a surprise to us that that's the case. For one thing, the healthcare systems that we have, mostly they were designed to deal with acute diseases. Whereas today, what most healthcare systems are dealing with are chronic diseases, or at least if they're not chronic, people are surviving and thriving for a longer period with diseases which in the past were quickly fatal. And so it's putting more and more pressure on the system. And because the system wasn't really designed for that, what we're seeing is, hundreds of thousands, millions of people showing up in hospitals because that's where healthcare is mostly delivered. I think everybody's coming to the conclusion that there's almost certainly a different way of doing this, and that we should all be trying to figure out, healthcare system administrators, us, and companies like ours who develop medicines, how can we do it in a way that doesn't require patients to be in a hospital unless there's some overarching need for them to be there? In other words, can we figure out a way of diagnosing and developing medicines that can be used somewhere else than in a hospital? The trend is really strong. We've done it often by taking medicines which you used to have to deliver intravenously and turning them into things that you can use subcutaneously. So then you can apply them not in a hospital. Or if a patient has to go to a hospital, they stay there for much less time and it frees up resources, and it's also better for the patients. I see that happening more and more, and it should. Sometimes I think people confuse this with, does that mean we're going to try and make sure that every medicine is delivered to a patient at home or at the patient's home? And it could, but it doesn't have to. And I think that's the really interesting discussion. I see lots of interesting things happening here in Brazil about using different elements and different parts of the healthcare system to deliver different kinds of care. It's something that other countries, I think, could learn a lot from too.
Interessante. Agora, te ouvindo, eu estava refletindo um pouco e isso conecta com a minha próxima pergunta, né? Você disse que todo mundo deveria estar preocupado em talvez mudar a forma como a gente faz a saúde, porque fomos acostumados a lidar de outra forma. E aqui no Brasil, e imagino e sei que isso acontece em alguns outros países também, a gente tem um modelo de remuneração que às vezes prioriza ou faz com que a saúde aconteça dessa forma. Então, você paga pelo uso, você acaba indo para o hospital e todo o sistema ele é articulado para funcionar dessa forma. Você acha que tem uma forma, talvez, de dar um reset nesse tipo de sistema? Tem algumas outras partes do mundo que têm avançado num outro tipo de modelo que talvez favoreça esse olhar para a prevenção, esse olhar para o paciente, menos essa situação hospitalocêntrica que a gente chama aqui. Não sei se é uma palavra que você vai entender em português, mas é isso.
It's very similar to the English one, that one. There are examples around the place. And again, I go back to COVID, actually, because we have examples where in Greece, for example, it was, until COVID, obligatory for a patient to go and get their breast cancer treatment in a hospital. And then it came not from us, but it came from doctors within the healthcare system who were saying, actually, there's ways where we could not oblige patients to come to a hospital. We could treat them somewhere else, including at their home, by having nurses go visit them. But in order for that to happen, the law has to change. And they did it. They actually changed it really quickly. They agreed with the government of Greece that they would run a local pilot just to make sure that it was possible to do it and safe to do it. They did that, and then really quickly, actually, they just changed the law. So there are small examples around the place of this. It requires a lot of change, for sure. I mean, it requires changes to legislation sometimes. It requires change in the way that healthcare systems are organized. It requires nurses and doctors to be in different places sometimes. It does take a lot. So it's not a trivial thing to change. And I guess it's something that's not going to change very quickly, but I do see the trend heading in that direction, and I think it's a good one. Say it's a good one for me as a potential patient, but also I think for a healthcare system and the sustainability of the systems.
E agora é uma pergunta que não tem como eu não fazer com você sentado aqui, que é sobre pipeline. Eu acho que a gente caminhando um pouco para a nossa conversa e falamos aqui de tendência do momento atual, dessa comparação do Brasil com outros países, mas tem algo que acho que une muito, inclusive o negócio da Roche, que é aposta, né? O que vem por aí, quais são as tendências e quais são as apostas da Roche em relação a novos medicamentos, a trazer esses tratamentos para doenças que às vezes os pacientes não têm ainda nenhum tipo de solução, né?
And this is something I'm really excited about. And I can't help now but do a bit of propaganda for Roche. So I hope you'll forgive me
You
for
can
that.
do it.
I hope you'll forgive me for that. Roche is a 127 or 128-year-old company, and its lifeblood and our lifeblood is to innovate. That's what we do. We don't manufacture generics or biosimilar drugs, and don't criticize anybody who does, but it's just not our thing. Our thing is to try and figure out how can we make significant advances in the care of people with diseases which have a really high societal burden. So we're talking about cancer, we're talking about multiple sclerosis, we're talking about, in the future, Parkinson's and Alzheimer's and all of those diseases. It's like you called it a bet, and it is. You have to invest a lot of money at risk in order to do this. And we accept that as being part of our lives, really. But when we combine a lot of the things that we've been talking about, you combine data analytics and better understanding of disease biology and the potential to treat patients in different care settings and all of those things, and then I think about Alzheimer's, say, and we're beginning to get an idea of how Alzheimer's works and why, and beginning to get ideas about how we might change that. And I think in the next number of years, we're going to see huge advances in that. And so that's what we do. We've been, we have actually, I think, one of the youngest or newest portfolios of medicines in the market today. So nearly all of the medicines that we have been launched in the last 7 or 8 years at most. And so we're trying to make sure that they get to the patients who need them wherever they are around the world. And then, you can probably tell from my when I think about what my colleagues in R&D are doing, most of which is far too sophisticated scientifically for me to really understand. But when I think about the application of it, I just think, wow, we could be in for another huge leap forward.
Muitas coisas devem acontecer nos próximos 10 anos.
I'm pretty sure they will.
É interessante, muito bom. Padraic, agora pensando no futuro, né? Queria um pouco do teu olhar, não só para a companhia, mas também olhando e analisando todo esse cenário que você traçou tão bem aqui durante a nossa conversa, né? Para onde que estão os próximos passos da Roche? E também acho que eu queria um pouco da tua análise depois desse momento de transformação que você também trouxe no começo para a gente.
Another huge question.
Mais meia hora de conversa.
No, it could be days. Look, maybe I can break it down this way. I have two roles within Roche. One is that I have a functional leadership role, so to lead the organization that we have in those 150 countries, and then I'm also part of the leadership team of the whole organization. When I think about the first one of those two things, then I really focus with my 12,000 colleagues around the world on the next 2, 3, 4, 5 years. What I'm looking for there, I'm really focused on there, is to say, okay, we have this pipe with this already launched set of really new medicines. They're still not close to providing all of the benefit that they could provide to patients who need them around the world. And so let's be creative now, and let's be open and humble enough to recognize that we don't have all the answers, but let's work with the healthcare systems and the people who work in the healthcare systems around the world to figure out how can we do this in a way that more patients get more benefit from these medicines, more patients get that benefit faster than they were getting them before, and more patients get them in a way that's sustainable for the healthcare systems that we serve. And sometimes people think that there's a conflict between the way we think about, the commercialization of our medicines and sustainability of the healthcare system. Actually, there isn't. We may have a different perspective on things sometimes, for sure. But in the end of the day, if the healthcare systems are not sustainable, then there's no reason for us to exist as a company. If there's no way of delivering medicines to a patient because the healthcare systems are all bankrupt, there's no reason for us to exist as an organization. And we do take a very long-term view of these things. we have to deliver in the short term for sure, but we have to think about it in the long term. So that's the key for the next few years. How can we work together across all of the 150 countries and figure out ways of partnering with healthcare systems to make sure that they get what they need, and so do we. When I think about the longer term, then it's some of the things we were talking about just now, which is to say, okay, could be opportunities in cardiovascular medicine, or there could be opportunities in diabetes care, both of which we're really involved in, or Parkinson's, which we're involved in too, or Alzheimer's, which we're involved in as well. How can we develop medicines in a way that are really effective and safe and are designed in a way to help healthcare systems be sustainable? And so that's what I spend a lot of the other half of my time doing. And so I'm a positive and optimistic person by nature. Mm-hmm. It's not that I don't recognize that there are challenges and difficulties. There are. But I do believe that if we put our minds to it and if we work together, life sciences, universities, so healthcare systems, and the doctors and nurses who work within it, the people who administrate those systems, us as an industry and others, if we're really serious about putting our minds together, then we can solve nearly all of those problems given time.
Tem que estar todo mundo remando na mesma direção, né?
Yeah, focused on like I said before, focused on the outcome that's common. There are things that are different about what we all need to do, but there are some things that are common. And in the end, the thing that's common is we're all there because there are patients out there who either have diseases or could develop them who need things from us. And if we can keep our minds focused on that and then figure out, okay, each one of us, what is it that we can contribute to this? Then I think we have a better chance of being successful than if we just focus short-term on our own individual interests.
Padraic, tem uma última pergunta, que é a que eu faço para todos os meus convidados, que é quais são as pautas que a gente aqui no Futuro da Saúde tem que prestar atenção? E aí pode ser nesse próximo ano, para o ano que vem, mas quais são os temas que a gente precisa ficar de olho?
Wow, there's so many. I mean, maybe I would start with some of the things we've been talking about and then add in one or two. I think the application of data analytics, artificial intelligence, and all of those things focused on using them in a way that's interoperable. And by the way, something that we haven't talked about, which is really important, is respecting the privacy of individual people's data. I think that's one of those things which we all need to get our arms around. And I think in some ways we are all together. So that's one. And then associated with that, I would then come back to the decentralization of healthcare. I think we need to help healthcare systems to thrive rather than just survive. And one of the ways that we could do that is figure out what is the best flow for a patient. What's the best place for you to be diagnosed? What's the best way for you to be diagnosed? What's the best way for prevention to take place? What's the best way for treatment to take place once it's needed? And it doesn't always have to be sending everybody to the same hospital.
É uma mentalidade de questionar sempre, né? E ser criativo, como você disse antes. Né?
Yeah, it's part of my makeup, Natalia, that I just am a curious person. And so I like asking questions and just wondering what might be possible if we thought about things in a different way. It doesn't always lead to things that are useful, but sometimes it does.
Muito bom. Padraic, eu queria te agradecer demais. Foi um prazer receber você aqui, te ouvir e aprender com os teus insights. Obrigada.
Thank you very much.
Obrigada. Muito obrigada a todos vocês que acompanharam a gente até agora. Se você ainda não assina o canal, não se esqueça de assinar. Até a próxima.